So I'm Viola. I'm a doctor in public health, and I currently work as an independent researcher in health promotion. And I'm supporting a few projects here in Spain about community engagement and local partnership for health. What I'm going to focus on is one way to mobilize community, which is the asset-based approach. So I'm going to talk about the underpinning theories of asset-based approaches and how does that relate to the ways that we mobilize community, and more specifically how we mobilize the assets in our community, and how does that relate to promoting community health. Okay, so asset-based approaches, even though I'm not sure how many people have heard this term before this lecture, I hope that at least a few of you have, but it's quite a complex issue and it's been increasingly used in health promotion in the recent years, but it's not a very well-defined topic as well. So let's just try to dig into a little bit more. So there are three main theories that are associated with asset-based approaches. So when you hear asset-based approaches, you most often hear related to it the term salutogenesis. Salutogenesis was a term that was coined by this person in the picture, Aaron Antonovsky, who was a medical sociologist. And he coined this term while he was doing a research with Israeli women who had survived the Holocaust. And he realized that even though there was about 2/3 of the group of women that he was working with that were actually suffering post-traumatic stress disorder, etc., and a number of problems, there were also 1/3 of these women that were actually coping quite well, despite having survived the Holocaust and the horrifying experience. So he said, so what is it about this group of women, the ones that are maintaining their health? What is it about them that keep them healthy and that keep them going? He started looking at this group of women who maintain their health, and this is why when we talk about salutogenesis, we talk about this shift of perspective from looking at the risk factors of what's going wrong, you start looking at what's going well. So what are the factors that keep people being healthy? So together with that, most of the time asset-based approaches are associated with the ABCD movement, which is the acronym for asset-based community development. And it started with these two persons in the screen as well, McKnight and Kretzmann, during the 90s in the US, because they started working with communities, and rather than looking at what was wrong in this community, they started looking at what this community had that could support their community development. So we're not looking again at the risk factors of what's going wrong, but we're looking at what are the positive things about communities, because there's always something positive about communities. So let's just work on that. And then finally, most recently, about around 2007, Anthony Morgan and Eric Zilio created this asset model, which basically said that if we can use salutogenesis, and if we can use the strategies that ABCD recommends, so mapping the assets, working with the positive things in community, and we can evaluate these interventions, then we can create an evidence base for asset-based approaches, which is what was lacking. So basically what this Anthony Morgan and Eddie Auxilio did was to bring it all together and bring it into health promotion. However, when you start reading around asset-based approaches, you'll find that it's not as easy as that. So it's not just that they draw on these three theories, salutogenesis, ABCD, and the asset model, but they draw on another variety of theory. And these are just a few examples of concepts and approaches that keeps coming up if you read about asset-based approaches. So you'll often hear about resilience, you'll often hear about empowerment, engagement theory, capacity, social capital. And most of the times, these are defined as the underpinning theory, but sometimes they're also defined as the outcome that you can achieve when you're working with community using an asset-based approach. So as Didier was saying yesterday about community health, also asset-based approaches found themselves at the crossroad. So they sort of drawn on different theories from health promotion, from social change, etc., etc. So you'll see it's quite a variety and a diversity, as the topic of the workshop is. They're also quite a diverse approach to work with, which makes it a bit difficult. So as a recap, I know you've had the paper in your reading list, but I think you've had so many inputs and so many readings during these days. So I'll just have a quick recap about what we actually mean when we talk about asset-based approaches. As I said, it's not a well-defined area, so I'll just use the definition that I used in the paper, which define asset-based approaches as interventions that focus on identifying and mobilizing community assets to support health and well-being and on strengthening people's capacity to make the best use of these resources with an aim to increase control over their health and that of their community. So as you can see, I've identified the 3 key terms, which will be the ones that will be further explored during the lecture. So the 3 key terms in asset-based approaches, as I said, it's about identifying and mobilizing community assets. So let's start from the last one. So assets, what is a health asset? In terms of the actual definition, the one that is most commonly used is the one that Anthony Morgan and Ariel Zilio provided in 2007, and it's any factor or resources, which I can't read it all because I have the screens I can see now, which enhances the ability of individuals, groups, communities, populations, social system, and institution to maintain and sustain health and well-being. But I'm quite curious to see what you thought a health asset could be. So this is why I've asked you at the beginning.
Can you read it?
Yeah. Okay. So there's a lot of things coming up in terms of what a health asset is: cultural happiness, physical support, family, resources, community needs, resilience is the one that is the bigger one that keeps coming up. Stakeholders, volunteers, well-being, financial access, I guess. Great. Thank you. That was just to get a bit of a flavor. Okay, so as you saw, there was so many things that could be a health asset. And actually, as you saw in the definition, is any factor. So it could be groups and association, it could be individuals, it could be institution, it could be the built environment, it could be culture, it could be resilience, as you put. But the most important thing is that because it can be so various and such a diverse opinion, depending on who you're speaking to, what's important is that you engage in a conversation about what a health asset is. So don't assume if you're working with communities that you know what the assets of these communities are, but ask them, ask people what is good for you in your community. And that's extremely important because sometimes we just sort of jump into communities and think, oh, this is what's wrong and this is what's okay. So we'll just work with that. And we don't engage in this conversation, which is actually quite important because they can give you a totally different perspective from what you may have as an external person. So that's related to what we were saying before, the other 2 key terms, which is identifying and mobilizing the asset. When we talk about identifying asset, the most commonly used approach is doing asset map, which was the original one that Kretzmann and McKnight suggested. And there can be multiple ways to do asset mapping. And I'm happy to talk about it at the end of the talk, if anyone is interested. But what I really wanted to stress in the lecture is that why are we mapping assets? Because sometimes I've heard, we just do an asset map and that's it. And it's like, well, if you do an asset map, it's because you're trying to respond to some local needs. So taking an asset-based approach is not about we just look at what's positive and we completely forget about, the health needs of the people or what's going also wrong in this community. So we also need to think about, okay, I'm mapping the assets, but there are still health needs that I need to respond to. And our job as health promoter is to match these 2 things together. So not working with what's wrong, but using what's good and positive in this community, the asset, to respond to the health needs that the local population has identified. And this is extremely important because sometimes if we only do an asset map, it creates a good momentum, it creates good vibe with the people. But then if we leave it like that, the result is that you can risk generating more frustration. So you're actually doing worse than good because you're creating some sort of people are expecting that something will happen after mapping asset. And then if you lose that momentum, you sort of create this frustration among the people. So it's extremely important that we keep these 2 together, health needs and health assets. And how do we respond to the identifying local health needs? Is by mobilizing these assets. So in the literature that I've reviewed during my PhD, I found 3 main ways to mobilize these assets. First one, it's a process about connecting assets among themselves. So you may have people that work in a community and they decide to get together and create new partnerships to promote local health or a new partnership in the school that you have, you know, teachers and students and parents all working together for specific health needs in the school, etc. Then a second approach would be raise awareness of potential assets, because sometimes there are assets in the community that people are not aware of. And that could be the case, for instance, in access and use of certain health services, which people may not be aware of. So what you need to do would be sort of engage in a campaign or engage in sharing information in your network about there is the service and you can access it and use it in this way. Or social prescription, it's another example of a way to raise awareness about assets. You work with GPs and you have sort of assets, community assets, and you can ask GPs to refer their patients to this community asset. And it's all about making people aware of all the good things that they have in their communities so they can use them and feel better. And then the third one, it's called Enable Assets to Thrive. And this may sound a little bit more top-down rather than horizontal, working with engagement, but it's still very valuable because it's about, you know, people working in communities that recognize potential assets in the community. For instance, some community leaders or a specific group of people that has been ignored up to now, etc. And you work with them. So you think these people have the potential to be good members of their community or to become leaders in their community. So you work with them to sort of create the environment for them to thrive. This is why it's about enabling assets to thrive. So there are assets, but they need a little bit of extra support to be able to thrive. So these are the three main processes that you can use to mobilize assets. But it's not so simple, so to speak. So it's not that you just pick one and off you go with your intervention, because most of the time you can have these processes as ongoing, they can be combined, they can start at different stages during the intervention. So that makes it even more difficult when working in communities. So let's have an example. So we are a group of people and we would like to do something about our community. So we start identifying a few people and a few organizations that we feel we can work with, and we get together and we form a partnership to promote local health. So this way, somehow we are enabling assets to thrive because we identified the first three people we identified the assets in our community, but at the same time, we're also connecting all these assets together. Then once we get together, we decide that what we can do is to restore the local library. So restore the local library. And we also decide that we can work with young people and train them to become health promoter among their peers in the school and create a sports club. So these are the two actions that we decide to do. And these two actions can be an example of enabling assets to thrive. We have a library which was underused, so we sort of restore it and reopen it. And then we recognize that young people can be assets in their communities, and we work with them so they can become these assets and support health of their peers. Then a few years down the line, we decide to contact also the local primary health care team and suggest that they may engage in a social prescription program so that they can recommend the sports club that we created with the young people to some of their younger patients. And that's another project that as a partnership we can do. So as you can see, we are doing raising awareness in this case. So as you can see, as we do this mobilizing of the assets, we're also creating health promotion activities. So from the example that I just gave, you know, we started working together, and this working together can lead to developing new relationships, increasing trust among community members. And then the second action about the sports club with the young people can support better health behavior for people accessing the sports club, but can also support skills development in people being trained. Okay, so we have increased health literacy, important analytic, shared decision-making, cohesion, health, behavior, health improvement, being active, involvement, exchange, empowerment, well-being, changes again, safety, vaccinated functionality, very good, transmission, genetics, ABG, I don't know what that is, but yeah, so that sort of gives you a flavor of the variety and the diversity of outcome that we can have in a community, right? As you can see from what you wrote, there can be quite a variety and a diversity of outcome when we talk about community health. So again, in the scoping review that we carried out, these were the outcomes that asset-based approaches were aiming at. So as you can see, you can range from individual level outcomes, community level outcomes, or organizational level outcomes. And this can be quite varied, because even within the individual level outcome, we're not just talking about the traditional health behavior approach. You know, you have the increase in healthy eating, physical activity, reduced obesity, etc. But you can also have reduced stress, or self-confidence, or developing new skills, capacity building. So all these sort of outcomes can, you know, happen at different stages, can be happening throughout the mobilization of the asset and after the mobilization of the asset. And again, at community level, you have, as you said as well, engagement, empowerment, but you can also have sense of belonging into the community. You can actually create new jobs, or, you know, creating new volunteers role, or create new partnership, as I was saying in the example, or social cohesion, as some of you put as well, or social capital. So it's quite a complex environment. And that's good, because this is what community health is about. You know, you have to work going beyond the health behavior approach and start to tackling the wider determinants of health. So as we saw from the previous slide, there were quite a lot of outcomes that can be located into the social and community networks. So for instance, partnership, or increase social network, or engagement, etc. They can all fit into the social and community networks. But we can also think about a partnership to sort of work on advocacy, for instance. So you can have a partnership that work on advocacy to change health policies. And that will be going way beyond, you know, situating yourself in the broader general social, economic, cultural, and environmental conditions that affect health. So what I'm trying to say here is that we need to start looking beyond the traditional approaches at health behavior, and thinking that with community health and with asset-based approaches and mobilizing community, you can move around this, you know, rainbow and go into different areas and tackling different health determinants at the same time. So going towards conclusion and leaving a few minutes for the Q&A session as well, one of the main learning points that I hope you can take away from this presentation is that community health is complex. And by complexity, by complex, we mean something that is non-linear, so you can't predict it, and it's quite flexible because it adapts. So I repeat again, it's non-linear, it's flexible because it adapts, and you can't predict it. So we need to sort of forget this traditional way of doing community intervention, you know, like I map my assets, I mobilize my assets, and then I get this health outcome, right? This is quite a linear process, and this is not how community health works. So you may want to think more something like this. So taking from the example before, you know, we got connected, and then we developed a new relationship. Then we started doing the enabling assets to thrive. But then at the same time, we were developing trust among the people working together. We were also developing skills for young people. Then we were raising awareness about the sports club. And then we were increasing better health behavior. And by having better health behavior, you know, you can engage in other things, and you're still developing skills. And then you're connecting again with other resources. So that's somehow the complexity that we need to deal with when we work with community health, which makes it so challenging. As a quick recap then, I know I went very fast at the beginning, so apologies about that, but we had a look at the theories underpinning the asset-based approaches, and more specifically, we look at the salutogenesis, the ABCD movement, and the asset model as the three main ones, but also remember that there's a lot of other theories and concepts that are associated with asset-based approaches. Then we had a look at what an asset can be. And as I said before, remember to engage in this conversation with the communities, like what a health asset is for the people you're working with. And then you can have this conversation about what a health asset is. So you're identifying the assets, and then you mobilize those assets in terms of relating them to the health needs that you have also identified. And that's a way that through mobilizing assets, you can promote health. And remember that all this is quite complex, so it's quite okay to feel lost in it. And I think that's the beauty for me about community health, because it's always something new and you're always learning. It's a constant learning curve, no matter how many years of experience you may have. It's always a learning curve. So I think that's the most exciting part of working in health promotion in communities. I put down a few more references in case people are interested in the asset-based approach. And I think Sylvia will share the slides at the end, but if anyone is interested in knowing more, please feel free to send me an email or, just whatever, just get in contact, and I'm happy to talk more about it.